if you're a woman of this age and you've been experiencing symptoms that are called normal, so things like brain fog and fatigue and night sweats and hot flashes and lack of libido, then you need to listen to this podcast today because these symptoms do not have to be your reality. This is Wellness by Design. I'm your host, Jane Hogan, the Wellness Engineer, and my guest today is medical doctor, Dr. Aimee Duffy. Now, Dr. Aimee is, as I said, conventional medical doctor, but she practices integrative and functional medicine, specializing in hormone health. And we have such a great conversation talking about how she practices, why it's so important to get testing done, especially not just one, but like if you're doing saliva tests, you want to do it throughout the day. Also, lifestyle things, the power of nitric oxide. And also, she talks about a workout that is designed to build up nitric oxide. All of this to help reduce, eliminate those symptoms that we have been told are normal. They are common, they don't have to be normal. All right, I think you're really going to enjoy this episode. I did. I learned a whole lot. So let's get started, and I'll see you inside. Dr. Aimee Duffy, I'm so happy that you're here today on Wellness by Design. So welcome.
Hey, thank you so much. Thanks for putting this on and getting this message out. It's awesome.
Well, I'm so happy that I got to meet you in person and learn about what you're doing. And really, we got some interesting stuff we're going to share with the audience today. But first, I'd love to hear about you're a medical doctor trained conventionally. Now you're practicing more integrative functional medicine
Yeah.
style. So, what took you to that path?
How
Why?
did we end up here, right? Well, it kind of goes way back for me in this process of how did I end up here. When I was a little girl, I just absolutely loved babies and anything to do with babies. I had Cabbage Patch Kids and all the accessories and the clothes and the high chairs and all the stuff that went with them. And so anytime I could hold a baby or play with a baby, I just absolutely loved it. And that led to me being a babysitter as, my first job. About 11 years old, I started babysitting for a family that had baby, and they had more babies and their babies grew and things like that. And so when I was a senior in high school, they were having another baby and invited me to be in the delivery room with them. And this was just a very amazing experience. I didn't really have any really medical experience at all, except me going to my own doctor or whatever. So I got to be in the delivery room and just that experience of baby Joshua being put on his mom's chest after the business part was done. And I just thought, this is so cool. Like, this is what I want to do. I want to deliver babies. And so I went to college, I went to medical school and thought I was going to be a baby delivering doctor, which I was, but usually that's an OBGYN. And then I did my family practice rotation. And so they were delivering babies, but then they were taking care of the babies and they were having babies of their own. And so it was just, and then I got pregnant my third year of medical school. So I had a baby of my own in med school. So I really wanted a life that was going to be a little bit more supportive, if you want to call it, or functional in having a family of my own. So I went the family practice route, but I still was really heavy on obstetrics. And so I delivered tons of babies in my residency, delivered my own fourth baby. That's a whole story in and of itself, and ended up as a family practice practitioner joining an OBGYN practice to be the primary care doctor for all these women and then also delivering babies. So, we shared calls. So I did the OB part and then I did primary care part. But it threw me into a world because in family practice, we're doing medical stuff, but we really didn't spend a whole lot of time on hormone replacement and women's health. And so when I got thrown into this OBGYN world, that was a very popular part of my conversations with my patients. And that was back when the Women's Health Initiative had just come out, and like there was a lot of controversy and scariness about hormone replacement. And so I had, women that were terrified of it and women that were on it, and I was terrified of it and wanted them to get off. And we didn't really have a good substitute, if you want to call it.
Mhm.
And really what was coming out is, well, you could do the lowest dose possible for the shortest amount of time and you should be okay. But there was really no testing and no way, to really be comfortable in that. So I ended up magically, I think, through the universe at a natural hormone balancing conference over the weekend that my sister was getting married in San Diego. And so it was like Alice in Wonderland going into this tiny little hole of a door into this world of like, if you want to call it integrative functional medicine, whatever it is, but this idea that you could test hormones, you know, replace what's missing or what's out of balance, and then, see these results that were not only more effective than whatever we were doing as prescriptions, but also safer. And that
Mhm.
really started my journey of recognizing, okay, testing, and I was introduced to the idea of adrenal dysfunction. We didn't learn anything about that in medical school, and different ways of looking at thyroid. And then that then led to what I found is as I was helping people with their hormones, they might have gut issues. And I was like, oh, well, this same lab that does saliva testing does some sort of gut test. So let me do that on you and see what that comes up. So it was like a learning curve of just treating my patients and using these labs that I didn't even know existed that helped us to really figure out what the underlying cause was of their imbalances and dysfunction, and really starting to recognize this idea that, I went into delivering babies because I always thought it was fun medicine. We women wanted to come to the doctor to hear about their baby and see their baby, and they were excited about when the hospital was going to happen, as opposed to, the sick care system when it's like the dread. And what I found in this is that it was really like not delivering babies again, but it was really restoring life back to women who had really felt
Mm.
they lost their life. They were sick and tired of being sick and tired. They're not living life. They're not having fun anymore. They're just kind of surviving through their day. And when I started this approach to medicine and really knocking out those imbalances and getting things back in order, they had their life back even more so than what they thought. And it wasn't, just a prescription for an antidepressant or the band-aid of sleep disturbances or weight gain or whatever the symptoms are that we're dealing with in that time frame. So that's really what happened. And then that office ended up getting bought out by the hospital system, and I knew that I didn't want to be in the box of the system. I wasn't going to be able to do those things that I wanted to do and order those tests and support supplements and all that sort of stuff. So in 2011, I opened Carolina Integrative Medicine. So almost 15 years ago now, and it is just grown from me by myself with one nurse and one office person to a staff of 12. And, we really just, I love what I do. And it's really fun to go to work because it really is life-changing. And now I can not only help the patients, but I get to do things like this where I can share this message that, if you have a symptom and you're told it's normal, it doesn't have to be that way. There's so many things that we can do to really get your life back on track.
Mm. Wow. Okay. That is an incredible story. I love that it's all because you love babies.
Yeah.
Um,
All the babies.
no, so let's just talk about that for a minute. The difference between a conventional approach to, oh, I've got these hot flashes, I can't sleep at night, no libido, those kinds of
Right.
symptoms that a lot of women are talking about when they're in their, like premenopause to menopause to beyond. How is the approach that you do different? Because obviously it must be because you left that system to have your
Right.
own practice. How is it different than the conventional approach?
In terms of hormone replacement specifically, I think you can sort of see the boxes, if you want to call it. So if you're perimenopausal, you're still having cycles, but you're having all these symptoms.
Mhm.
Hormone replacement comes in the form of birth control pills. So basically you're prescribed, let's just, even though you don't need it for contraception, we're just going to put you on birth control to level everything out. You hear that all the time. And then
Yeah.
try this for 3 to 6 months. If that one doesn't work, we'll switch you to a different one. And there's again, it's really there's no testing. I've heard patients all the time, well, there's no point in testing your hormones because they're going to be normal if you're still having cycles. And so there's a lot of imbalances that can happen. So even if your levels are technically within range, they may be out of balance to the point where there's some room for rebalancing that. And also in that stage, I think one of the main symptoms that we see in women, like really between 40 and 50, maybe even a little bit earlier, is just the anxiety, depression, the mental health, the
Hmm.
overwhelm. And so like the number one prescribed medication is Lipitor for cholesterol, and the number two is Lexapro for, whatever ails your brain kind of thing. And so, you know, that's really just what's the band-aid to treat the symptom. And then when you transition over into menopause and hormone replacement, still there's not a whole lot of testing. In traditional medicine, it's just sort of like, okay, you're menopausal, you're having whatever your symptom is, hot flashes, let's say that. And so it's like, do you have a uterus? Yes or no? And then you get estrogen if you don't have a uterus. And if you have a uterus still, then you get estrogen and progesterone. And again, there's no conversation about what the dosing needs to be, what the proper way to do it. So what we learned from that Women's Health Initiative is that getting oral hormones is what really causes all the negative effects with the blood clots and the heart disease and strokes and even breast cancers. And if hormones are replaced topically, is the number one way that is most beneficial, then not only do we see less risk, but we actually see prevention in some chronic diseases that we're seeing in women over 50. And so, it's such a relief to kind of get that awareness of not only can we help you with a symptom, but you don't have to go into it with this fear that it's going to cause you harm. And really, in traditional medicine, you see that with everything. Somebody's prescribed a statin for cholesterol, and it's like, this is going to help your cholesterol. But then, there's knowledge and awareness out there that are these okay? We have to test your liver every 3 to 6 months. And, people hear about the muscle aches and pains, or is this going to cause my brain to not work the way it's supposed to? And so you're going into this thinking this is supposed to help me, but yet there's this resistance or this fear that there's some side effect that I'm going to have to deal with. And really, when we're talking about bioidentical hormones, because I do saliva testing in my patients and I look at all your hormones. And then we make sure that what we're replacing is what's needed to balance those all out and get back to optimal ranges. And then we repeat the test to make sure that what we're doing is effective as well as safe. And so it really gives this sense of relief, not only in reducing the symptoms, but in knowing that this is not causing me harm. And in fact, can actually, improve my long-term health and some of the preventative ways that we can see hormone replacement in older women.
Mm. So sounds like the big differences are you do testing before,
Mhm.
testing afterwards. And it sounds like, you're addressing root causes, but more of a softer approach. You mentioned more topical as opposed to things taken orally for
Right,
hormone replacement
right.
specifically. So, and so you're seeing, I'm assuming, better outcomes with
Of
this.
course, yes. I mean, so you know, I think what we realize too is that hormones, if we want to talk about hormones, generally the idea is we're talking about estrogen and progesterone and testosterone, but cortisol is a hormone too. So we start leaning into adrenal dysfunction, which I never even learned about in traditional medicine. And thyroid is a hormone, and there are different ways to treat thyroid besides just the traditional, what's your TSH and here's your Synthroid or generic prescription. So, being able to address more of a bigger picture and understanding how they relate. So, for instance, we see in perimenopause, women are starting to have maybe some hot flashes, but usually more night sweats at night. They're not sleeping well. They may have some irregular periods. They're getting more irritability, some weight gain issues, not sleeping. And, again, the traditional approach is an antidepressant, a sleeping pill, or birth control. And what we can find is that this time in your life, you're getting a really significant decline in progesterone, but estrogen is sort of staying stable. So that's why it's such a kind of crazy time. Progesterone is really calming to your brain. That's what helps you sleep. That's what helps you, be parasympathetic and kind of more
Mm-hmm.
into, Zen mode instead of, hyper stressed out, that sort of thing. So if we can test and we can find that somebody is just out of balance and lower in progesterone than they should be, then you can replace that. And that's not, birth control is generally a mixture of both estrogens and progestins and synthetic things that we don't really need. And so it's not addressing the issue, which is that progesterone is low. And then well, why is that happening? Well, it could happen just because simply, the calendar is going by. I use that term instead of aging because, ugh, aging
Yeah.
sounds yucky. But, life is happening and the calendar is going by, and naturally our hormones are going to change. However, when you bring in the adrenal part, the adrenal glands make cortisol, which is your stress hormone. And generally, everybody thinks that their cortisol is so high, and it probably has been over the course of time. But at some point, it's like the adrenals are sprinting the marathon of life uphill all the time, and then they get tired, and we start to see lower cortisol levels. And cortisol is part of what is gives us energy. It wakes us up in the morning, and then when it goes down at night, we go to sleep naturally. But it's also your stress hormone. So when you are being chased by a lion, then
Mhm.
you should have an adrenaline rush and you're going to have cortisol go up. And so what happens is that your body is still back in caveman days. It's still trying to help you stay alive. So if cortisol is going down, it's going to sacrifice your ability to procreate to keep you alive. So it's going to pull progesterone away from, what should have been there to support the cortisol. And so it's understanding that there's a connection between what's happening, and they're not individual things, they actually relate to each other. So usually when I see hormone changes happen in somebody earlier than we expect, let's say you're 42, and you're going, I'm too young to be menopausal, but I'm having night sweats and I'm having, you know, decreased libido, or I'm not sleeping well or something like that. It's usually because your adrenals are fatigued. And so we need to address not only the low progesterone, but we need to address the adrenal dysfunction as well. Now then we can go down that path of what else is causing stress and, dig into the gut, and anything that we're dealing with in terms of exposure to all the toxins in our food and chemicals and the poor nutrition that may come from that, or inflammation. That's another internal stressor that's going to pull your adrenal, dysfunction even more in the wrong direction. So our approach is really hard to just say, okay, we're going to give you hormones, we're going to address adrenals, but then we're going to address, internal stressors as well as external stressors. So we start putting it all together. Um, as we turn, post-menopausal and we go through menopause, some women, they're like, I was amazing until, I hit menopause and then everything went crazy. And then that could be the hormones that then changed through menopause that then are now affecting cortisol levels or thyroid. So there's a interesting connection between the lack of estrogen and the ability to deliver thyroid hormone. And so, a lot of common knowledge is that, well, it's normal for women who are postmenopausal to need thyroid replacement. And I'm not disagreeing with that, and that's fine, but there's still a,
Normal,
you know,
not.
if we can catch it early enough and get on some estrogen replacement particular, then we may support that and not need thyroid replacement. Or their labs tell you need thyroid replacement and you get on thyroid replacement, but your symptoms are not improving. And so that can be frustrating for people thinking, oh, this is it. This is going to save my life and I'm going to feel so much better on my thyroid hormone, and then it doesn't change. So there's so many intricate intertwinings between the endocrine system, if you want to call it, and then you bring in the gut and, inflammatory issues and stuff like that. And so it's fascinating to me and I love doing it, but it's also not just, you can't just pick what's the Band-Aid or what's the pill and you're going to see, all the results fixed.
It's a real puzzle, right? Like putting all these pieces together, and then but it sounds like what you're doing is they're clicking, right? You're finding the
Yes.
right pieces and they're just clicking
So yeah, I
in
mean, and
place.
every patient is just a little bit different. You can see patterns, and see connections there, but what they've been through in life and what they've been exposed to and where their body is at that moment. So the testing is really absolutely phenomenal because you can just see exactly what's going on at that moment
Mhm.
and then, help support what the needs are and working through that. So absolutely, it's just it's this puzzle. It's the clock, I think about the clock, needing to just click in and turn, and now everything's moving the way it's supposed to. So it's
Yeah.
really fun.
I can ask you a question about the saliva testing.
Yeah.
So cortisol changes throughout the day, right? So is this saliva testing done like several times throughout the day?
Yep.
That's
So we
important, right?
do, yeah, absolutely. Normal is supposed to be your cortisol high in the morning and low at nighttime. And
Mm-hmm.
so we test 4 times throughout the day. So we test about 30 minutes after you wake up, around lunchtime, around dinner time, and then bedtime. And that gives us this picture, so it may be normal, it may be low in the morning and then it kicks up again, or it might be really low and then you get this, surge at nighttime. And those are the people that we call tired and wired. They're exhausted all day, but then when it's 9 p.m. and it's time to go to sleep, they're like, now my brain is busy and I can't fall asleep. So rather than trying to band-aid again, oh, take a sleeping aid or take melatonin or whatever, like if we know what pattern your cortisol is, then we can adjust our support system based on what we're seeing there. So it's really important to do that. I think unfortunately, if you're lucky enough to get cortisol tested, but it's just done like once a day, first thing in the morning, especially if that's a blood test. So, by the time you're awake and you're dressed and you're driving to the lab and then you get a needle in your arm, your cortisol may appear normal simply because that was work and effort to get to that place rather than what happens 30 minutes after you wake up, what is your own natural cortisol state. So I love
Mm-hmm.
saliva testing from that perspective because you're doing it at home and it's
Yeah,
super
and you
easy
can
to
get
collect
that.
the samples. And you're not going to go to the lab 4 times, especially at 10 p.m. when it's time to go to bed. That's not realistic to see what's actually happening in your body so that we can address the dysfunction there.
But you need that picture snapshots throughout the day in order to get the true picture of what's going on.
Absolutely.
Okay.
It's super easy. Even hearing this knowledge, you go, okay, I'm going to Google adrenal fatigue. Yes, I have all those symptoms. And then I'm going to go Google an adrenal supplement, right? And there is a million out there and they're all probably fine. It's okay. But yet, different supplements are working on different types of cortisol curves, so you may have one that's more stimulating and one that we need more calming. So it's even if you find that you feel like you have adrenal fatigue, there's still not a one size fits all approach to treating that. It's you have to look at that curve to see where the adjustments need to be made.
So find yourself a practitioner that will do this and ensure that they're doing that testing. And,
Yes.
I know you've got a brick and mortar business. You're just seeing patients for the most part where you
Yeah.
live, but go to, well, this is what I did. I went to the Institute for Functional Medicine, find a practitioner, find
Yes.
someone in your area, or if there's no one, I live in Newfoundland. Back then there were, I don't think there's still any here, but I found someone that would work with me online. And so that's what I did. So find someone, don't just like slap stuff at it. You're in
Yeah.
the long run, our biggest resource, our most valuable resource is our time. So get this sorted out sooner rather than guessing and slapping different things on there that may
Yeah.
not even
Trying
be
all
the
these
right
different
things,
things. Yeah.
and get your life back
You
sooner.
can, IFM is a great place.
Yep.
Also, there a lot of the places that do this test will guide you to a practitioner, that might be in your area. So, if you do a search in your area for and it doesn't even have to be labs, but like doctors' data is one, for instance, that does saliva testing. So you can go to their website and then there's a way where you can find practitioners that use their lab. So finding either the practitioner that does that or finding the lab that does it and then finding the source for a practitioner can be helpful too.
That's a great suggestion. I hadn't thought of that one, Aimee. So
Mhm.
really good. Okay. So Dr. Aimee, we were talking before we hit record about, and this is something I wasn't all that familiar with, the how hormones change when you've got a chronic condition. So a lot of people in our audience have chronic pain, but it can be chronic pain from,
Yeah.
fibromyalgia, rheumatoid arthritis, or a lot of different conditions. Sometimes it's other reasons, but how does having a chronic condition interplay with hormones?
Yeah. This is fascinating. And I actually, we were talking about it because that's what I'm speaking on next week at a conference. And so this is fresh in my mind because I've been working on the slides and the presentation. And and it's sort of figuring out which comes first, the chicken or the egg to some degree.
Mhm.
But my focus on this is actually the decline of hormones as we're getting into menopause and postmenopause that is then leading to some chronic disease. And so, and or like you said, are we dealing with some chronic pain or inflammatory stuff? And then when we hit menopause and the hormones go away, it just exacerbates that underlying dysfunction again. So there's multiple things that we can see in the different types of hormones and how they affect, like literally at the cellular level of signaling. For instance, we're talking about inflammation. Many of the hormones, estrogen, testosterone, progesterone, cortisol, are all anti-inflammatory. And so, as those decline in your system, inflammation tends to increase. And so we're going to see more things like rheumatoid arthritis or fibromyalgia, pain related. And so people don't think about hormones as pain relief to some degree, and they're not. It's not like you can slap on some hormone and it's like taking a pain pill. It doesn't work quite that quickly, but fairly quickly when we find the right balance and we get those in place, like I've seen pain relief within 2 to 4 weeks of somebody starting on support for their hormones or adrenals. And so relief of inflammation is really important. And then you think about, well, what does inflammation lead to in the chronic disease world? Cardiovascular disease is an inflammatory problem, right? We have inflammation inside our vessels, and that's where our cholesterol starts to stick to and plaque forms, and then we're more at risk for having a heart attack or a stroke from a cardiovascular event because of inflammation. And if those hormones are not in place, then we have less inflammation. There's also an interesting phenomenon with estrogen and nitric oxide. So I don't know if nitric oxide has been discussed or not, but nitric
Oh,
oxide
yeah.
is something that is supposed to be in our body. It does decline partly because we're not eating the foods that give us more nitric oxide, like beets and arugula and dark veggies. But also as we age, our stomach stops being able to convert nitric oxide appropriately. But what happens is the decline in estrogen actually decreases the ability for us to make nitric oxide as well from our foods. And
Mm.
so nitric oxide is important for relaxation of our blood vessels and opening up blood flow. So high blood pressure is a problem because our vessels are squeezing and they're too tight, and so there's increased pressure there. And if we can open them up and relax them, then we can reduce blood pressure. So there's a connection there between estrogen and nitric oxide deficiency that then could lead to concerns with high blood pressure. So everybody thinks that it's just aging that makes us have heart disease and high cholesterol and high blood pressure. So your hormones are all made from cholesterol. And then we're giving signals from our brain or from our ovaries or wherever that help them convert into their specific hormone, like an estrogen or a testosterone, but they're all created from the same thing. So as your hormones start to decline, your body kind of goes, well, we liked those hormones, they were good. And yet, your ovaries are done because they're not trying to procreate anymore. So the signal to, change happens, but in the short term, the body says we like those hormones, we should make more. So the signal goes to make more cholesterol with the hope that we're going to make more hormones, and that doesn't happen. So we see it all the time where, women will say, my cholesterol has been fine my whole life. Every time I've had it tested in my yearly exam or whatever, it's been fine. And then all of a sudden at 52 or 55 or 60, we get this flip and our cholesterol is now high, and it doesn't feel like that much has changed. But hormones can play a big role in our high cholesterol as well.
Mm.
So from a
And
cardiovascular perspective, there's a lot of connection between hormonal deficiencies and increased cardiovascular disease.
Dr. A, I don't think that's something people are hearing. Like if a woman, I'm 59, if and I just actually my family practitioner mention your cholesterol's up a little bit. And I think the first thing we would hear is let's go on a cholesterol
Diet.
reducing
Hmm.
drug. It's the first thing people
Yeah.
hear. They're not hearing this might have something to do with your hormones, and maybe it's the hormones we need to address first.
Yes. And
That
that, so
is,
that's a huge part for me. And like what that's why I'm saying it's fresh in my mind because I'm going to places and presenting this to practitioners because I want that to be the first thing, instead of what's the Band-Aid that's going to fix this. And so yes, I'm dealing with that in my own patients, but that's why I just want this message to get out there. And these are studies. I mean, it's not like this is hidden secret science. It's very easy to, find the studies that are showing this connection.
but
But it's not presented, again, it's
they're not hearing it.
easy, but then we go to the traditional medical system that, overworks and, exhausts our primary care doctors, and cardiologists and these people. So it's not necessarily their fault to their degree is that they're in this system to where it really doesn't give you any time to do research and to, want to go and think outside the box because you're just you're seeing patients, every 10 minutes, maybe, and you've
Mhm.
got, 50 patients to see in a day, and then you got a chart all night, and you're not getting any sleep, and you're not taking care of yourself. And the last thing you want to do is read some article about something else, I mean, you're spent
Mhm.
and you're tired. So,
And
it's a
even if they
frustrating.
did read it, they may be concerned about, well, are they practicing not in a way that's they're going to be supported?
Yes, that can be
Right?
scary too,
There's
especially
a
in this
lot.
hormone world of the scare of the women's health initiatives that hormones are bad. Every
Mhm.
day I still am, approached by that from patients who want to be on hormone replacement and they have doctors that have told them no,
Mhm.
it's not safe and we don't recommend that. And we know, through our research and multiple studies recently since, the 2000, 2020s, 19s, that hormone replacement is very safe when done correctly.
Mhm. So bioidentical, and
Topical,
targeted, right?
yes.
Okay. How much is you talked about inflammation earlier, inflammation leading to heart disease and so on. What about inflammation? I think I know the answer to this, inflammation and neurological issues like, you know,
Absolutely, yes.
dementia, Alzheimer's. I mean, everyone's afraid of these, so afraid of these, right?
Yes.
Is there a
So
hormone connection with that?
yes, there is definitely a hormone connection, and we see it not only just I think from a symptom perspective, the decline in hormones does lead to, one of the most common symptoms we hear for women in this age, 50, 60, 70, is brain fog. Is
Yeah.
that, it's not quite there. I'm kind of, it's like things aren't clear. I'm forgetting things, the senior moments that people kind of joke around about. It's very real and it's very much connected. The hormones, well, both things. So the inflammation is certainly causing some, dysfunction in our brains in terms of the ability of the neurons to work the way that they're supposed to and send the right signals, but the lack of the hormones also directly can affect the signaling happening in your brain. The lack of hormones actually decreases tryptophan, which is the precursor to serotonin. So, we're seeing more of the mood, the kind of blah. I don't feel like doing anything anymore. Like that's a very common symptom as well. But directly related to Alzheimer's dementia, there is a connection between not only estrogen, but testosterone and progesterone in plaque formation, the plaques, the amyloid plaques is what they're called, that are building in the neurons around the brain that cause Alzheimer's dementia. So again, is that the end all be all cause? But there is definitely a connection between hormone decline and those issues as well as the inflammatory process that's happening at the same time.
Mm, wow. That might be something
And
interesting for
the
people.
other thing that I have to add to that is the research shows that the earlier you can address that, the better. So it's much more difficult to have somebody who already has dementia or, signs of dementia later on in life replacing their hormones at that time could slow the progression, but from a preventative standpoint, the sooner that you can have hormones addressed and start to replace them, there's actually a significant difference in prevention of this cognitive decline as opposed to trying to fix it once it's already there.
Wow. Okay, that's incentive, I think, for people.
Yes.
Dr. Amy, we've been talking about hormone replacing the bioidentical. Are there lifestyle things that people can do that are going to help with their hormones?
Absolutely. So all of this is working together, right? And so, I think when we go back to the adrenal dysfunction and the stress and lifestyle, the two things that we really think about from a lifestyle perspective, although there's more, is food and movement, right? And then we can go into, some mindset stuff and stress management as well. But every time I talk to somebody about food and they go, well, what diet should I be on? And one, that's the D word, which means you're going to go on a diet, implies you're going to go off a diet. So, let's change that to what food should I eat? And really it can be as easy as just looking at the food you're about to put in your mouth and say, is this food going to fuel my body or is this food going to slow it down? And when my kids were really little, they were at Montessori school and they used to teach them about slow foods, grow foods, and glow foods. So
That's
the
cute.
foods that are going to make you glow are your vegetables, like carrots and spinach or broccoli or something like that. The foods that help you grow are protein, however you want to get your protein. And then foods that slow you down are going to be the breads, the carbs, the sugar, and it feels a little counterintuitive because a lot of people lead to those to give them a little boost of energy, right? We're looking for, I'm tired and I need this boost, but ultimately that's going to just slow the whole process down and it's not moving your boat forward. So you're over here, trying to do this and then you put something in the way and it just makes it really much more difficult for you to get your paddles going where you want them to go.
Hmm.
So it can be so specific as to eat this list and don't eat that list. And we actually do food sensitivity testings in my practice. So we can make it easier for our patients to know exactly what foods are stressing out their body. But if you don't have access to that testing, it's just going to be, what's my vegetable? What's my protein? Fat is not our enemy when we have good fat, so olive oils and avocado and nuts and things like that. And just try to stay away from the stuff that, took a long time to make, right? If we can take an apple from a tree and eat it, it's one step. You can pick a cucumber or you can, you know, pick some spinach and eat it right out, if it's organic, you don't even have to wash it, right? So like things that take little steps to get from where they came from to your body as opposed to something that's packaged, even bread, we don't go out and pick wheat and start chewing on it and then it turns into flour and we don't eat spoonfuls of flour either. So like there's multiple steps that have to get to that thing getting, from its original source to your mouth. So the least amount of steps, the better. So it can be as simple as that. Just think about, is this food going to help me grow and glow in a positive way, grow muscle, for instance, not grow in fat. And then from a movement perspective, I like to use the term conscious daily movement. I think any movement is great, but people get overwhelmed. I've got to join a gym and I've got to go, change my clothes and exercise and then that becomes overwhelming because they can't find the time to do it. And so if you can do baby steps instead of you know, big intentional, infrequent movements versus little tiny movements throughout the day where we actually see better results. Plus getting outside and getting, a little bit of fresh air. If you could take a 10-minute walk. I just did a nitric oxide workout outside of my patio, like 5 minutes before I popped on here. So I'm trying to get that nitric oxide flowing and I'm trying to get, just that little breath of fresh air. We finally have some sunshine today, after a few days of raininess. So
What's
trying
a
to get that
nitric
movement.
oxide exercise? What is that?
Nitric oxide is really fun. So we talked about the importance of nitric oxide.
Yeah.
So one of the things that happens is if your body perceives that it's deprived of oxygen, it's going to stimulate nitric oxide to open up your blood vessels and increase blood flow, right? So this exercise is actually I've got a YouTube video on it, so people can go to my YouTube page and see it. But you do 4 exercises. You do squats, and then you do these arm raises where you're just doing like this, and then you do like Superman, so you're doing like this, and then shoulder presses. And all of that you do with your nose, I mean, your mouth closed, so you're just breathing through,
Right.
so it deprives you of oxygen. And so that, movement of those 16 biggest muscles, so you're getting your legs and you're getting your back and your shoulders, is stimulating nitric oxide improvement. So you do those 4 exercises, count to 10 for each one, and then you repeat the whole series 4 times, and it literally takes 4 minutes. And it's a
Awesome.
great little start to your day. I do it, like I said, right before I'm going to be recording, or if I've been sitting at my desk or sitting with patients all day. It's a really easy thing to do. You don't sweat, so you're not going to get, you can do it in any clothes that you're in. Um, and so I love that little, plus you're doing squats, right? So you're going to build some muscle, and, it's
Hmm.
helpful from that perspective as well.
I've always heard of nitric oxide, like in terms of breath work, right? Because I do a lot with
Yes.
breath work and, keeping the mouth closed, as you said, so that you're building up, that in the airways up there and it's opening things up. But also, maybe have you heard about humming and how humming
Oh, yeah.
increases nitric
Yep.
oxide? Like I think it's like 15 times more than regular breathing. So maybe if
Mhm.
you hum while you do those exercises,
That
it'll.
sounds like a good idea. I'll play around with that. You can actually test nitric oxide. They have little strips that you can do, like you put it under your tongue and you measure saliva. We have those. That's a vital sign for us in our practice. Like they come in and they get their blood pressure and their pulse and their weight, and we measure nitric oxide on all our patients because it's that important to me to make sure that it's working right. So I'll do a little test and measure myself before, and then see if I can get it to go higher after I do that with humming. There's a lot of ways that you can increase nitric oxide. I like that little workout, not only because of nitric oxide, but just such an easy thing to do, several times throughout the day without really having to think too hard.
Did you say it's the saliva, like a test strip? You're testing nitric oxide?
Yep.
Oh, I
Yep.
didn't know about that. I have to look for that.
Yeah. It's so easy. And it's just, you stick it under your tongue for like 5 seconds, and then it's like a pH paper,
Yeah.
that kind of thing where it changes color. And the ones we use are pink. So it's either white or kind of a light pink, or it goes, darker, and then you get really dark pink. And then that means your nitric oxide level is adequate or optimal.
Wow. Okay. I have learned so much in this conversation today. I love it, Dr. Aimee. Okay. Is there anything we haven't talked about yet that you really, I know you've got such a big heart to share messages
Yeah.
with everyone. Is there anything we haven't
I mean,
covered?
there's so much that we can talk more about. I mean,
We could be
it's
for
really,
hours.
um, it can be overwhelming. I can talk and talk, and this is stuff that I do every day. So it's just right there in my brain. And so, somebody's hearing this and they're, ooh, I want to go find a saliva test and I want to do these things. But, even if you do just a few little things that are different, it's those baby steps that they're gonna start moving in the right direction. So there are things you can control. We're talking about this inflammation. So, can I reduce the amount of inflammation internally in my own body? And moving and is going to help us detox, and eating foods that are cleaner, and trying to avoid all the chemicals as much as you possibly can. So there's so many things that you can do on your own that don't require somebody like me, but then you can take it to the next level as well. So this is not meant to be overwhelming. It's supposed to be helpful and supportive and hopeful. So for somebody that hears it for the first time, they can start to go, oh, this isn't just me, or you know, I'm not broken. I think so many people just think they're broken, and it's really not that. It's just things aren't quite connecting the
Mm.
way they're supposed to. And, if we can make those connections happen, then you're gonna have much better results, which means you're gonna just live this amazing life and actually have fun.
You're so right. So many people just think, this is the way it is. I'm getting older, nothing I can
Yeah.
do. And so I love that you're giving people hope. It doesn't have to be like that. We can live vibrant and strong for many, many
Yes.
years.
Yeah.
Um, so you kind of started on this, but what would be a baby step that someone could do today, Dr. Aimee, that's going to begin to initiate the body's like healing response?
Well, we talked about, I mean, just what's your next meal? I mean, literally, it can be as easy as that. You can start today. Don't get caught up in what you've already done and how you might have messed things up or what you ate last night and whatever. So, what's your next meal? And then move, we've talked about this, just, do a nitric oxide after you listen to this or while you're listening to it. You can do a nitric oxide. You can wiggle in the car, I mean, if you're driving along in the car a lot, doing, we call it shiver size, where you just kind of shiver your whole body, and that can help too. So again, food and movement is such a just foundational thing that we're just not really doing a good job of. And then moving into things like breath work, we have access to everything we possibly want on our phone. So finding some meditation that resonates with you to just bring us back into that stress-free world is really helpful. So I think those are kind of the easy steps, like you said, that you can take to start. And then, maybe do some little bit of research to find a person in your area that does what we do, integrative medicine, functional medicine, bioidentical hormone replacement, saliva testing. Those are kind of some keywords that you can search for. A lot of people who take care of thyroid dysfunction or Hashimoto's thyroiditis are often functional medicine practitioners that do other things. So I'm just giving you some keywords. If you go, I don't even know what to search for and how would I would find, more information about that. Those are helpful too for you to do some searching and see whether you find someone local, that's brick and mortar, or you can find somebody that's, doing online support and you can do some things virtually too.
Great suggestions. And I know you've got a gift, which we're going to have a link there for people so they can download this free gift. Do you want to
Yeah.
talk about it and let people know what it's about?
I just created this. I mean, we call it a mini course. It's just 10 short videos. A lot of what we're talking, and in fact, now I need to update it for this, last thing about talking about hormone decline with chronic disease, because that's not on there yet. But I just try to pick, the things that are most common, like questions that you might have about thyroid or hormone deficiency, things like that. So it's a little bit more deep dive than what we're talking about today, but it's just 10 short videos. So we just call it this mini course. And it's just an opportunity for you to learn a little bit more and dig a little bit deeper in understanding what's going on with you.
Mm-hmm.
So happy to
Wonderful.
share
Thank
that.
you.
Yeah.
Thanks for that. And where is the best place for people to find out more about the work that you're doing or follow
Yeah.
what you're doing? Get this nitric oxide workout.
Yeah. So that, any of my social media links that you have access to that you'll post within your podcast. So I post nitric oxide workouts regularly because I'm always doing them somewhere. So you can find that. My YouTube channel has that. So Aimee Duffy, MD. Carolina Integrative Medicine is my practice. And that link to the mini course will bring you to that website as well. So you can search for me. You make sure you spell my name. It's Aimee. So, a lot of people mess that up. So Aimee Duffy, search for me on any social media, YouTube, and you can find my website.
And we'll have the links there too. So
Yeah.
if you're like, I didn't get that, just check the description below, the whatever's attached to however you're watching or listening to this, and you'll find it. Dr. Aimee, thank you so much for this
Thank
great
you.
message that you're sharing, for the work that you're doing in the world, and for being a guest on Wellness by Design today.
Thank you for having me. This is awesome. Have
Thanks to
fun.
everyone watching and listening. And you probably know someone who needs to hear about this. So please share this with them and check out Dr. Aimee and the work that she's doing. And we'll see you again soon on Wellness by Design.